So today we're going to take you through the story of this course. So National Heart and Lung Institute, it being the largest centre in Europe that researches into heart and lung disease, and is definitely UK's preeminent cardiorespiratory research centre. It has 3 campuses: Royal Brompton Hospital, Hammersmith Hospital, and the big basic sciences campus at South Kensington. We have over 500 staff, 4 fellows of the Royal Society, 22 fellows of the Academy of Medical Sciences, and over 190 million pounds of research grants come to us through competitive peer-reviewed funding. And that's something we're very proud of, our leading position in that. We are UK's leading teaching centre for medical undergraduates, especially those interested in cardiovascular and respiratory science. We have over 200 PhD students and 149 MSc students, and we need 1 more to make it 150, and that could be you. All you have to do is apply. Right. So here is a picture of our recent students. Our students come in having graduated from medical biosciences, from sports sciences, rehab, nutrition, pharmacology, as science graduates. We also have healthcare professionals who are nurses, physiotherapists, respiratory therapists, paramedics, and doctors, and also healthcare professionals from allied professions such as pharmaceuticals and sports science. So we're a very broad grouping. We are the only program actually in Europe that combines cardiovascular and respiratory sciences together. And we focus on clinical application of knowledge, evaluating the most recent international research and building evidence-based practice. We combine innovation and technology to try and improve healthcare for our patients. And we focus on learning real-world skills that will enhance your career in the future and can apply to more than one thing. During this MSc, which is primarily a research degree, you will conduct a research project in our world-class facilities, and you'll be supervised by our international authorities who are experts. So now I'll turn over to Leanne, who will tell you about the programme.
Thank you, Daryl. So I'm going to spend the next 10 to 15 minutes giving you an overview of the programme. I want to tell you all a little bit about how we teach and how we assess here at Imperial, and then I'm going to talk a bit about your research project. And then when you're excited about the programme that we offer, I'm going to outline our entry requirements and explain how you can apply to join us. So the Cardiovascular and Respiratory Healthcare Programme was established in 2018. It's now in its 6th year. The programme is designed to be flexible and can be taken as a full MSc, a postgraduate diploma, or a postgraduate certificate. Our students can choose to study full-time or part-time, and each year we have 25 spaces available. We teach our MSc face-to-face on campus, and we're primarily based at the Royal Brompton campus, but we also visit the Hammersmith campus and the main Imperial campus up at South Kensington. The programme lasts for 1 full calendar year of 52 weeks, and for the academic year 24 to 25, this will begin on the 28th of September. The structure of the programme that we offer is modular. We have both taught modules and research modules, and these can be completed in 3 different ways. And this is the full MSc, the diploma, or the certificate. All programmes undertake the taught modules, with the full MSc also requiring students to complete the research project. Our taught modules are split into 4 core modules. And these modules form the foundation of your learning on the MSc. And we also offer elective modules. And these allow our students to personalise their programme, towards their own interests. We offer 5 elective modules, and if you're doing the full MSc, you will choose 3 modules from this choice of 5. And we find that students typically choose the elective modules according to their interests, but they also make choices based upon the skills that they wish to develop and the learning experiences that they want to have. And I'm going to give you a few more details about our taught modules in the next 2 slides. So our 4 core modules form the foundation of our programme and reflect our scientific and clinical approach to healthcare. Foundations of Cardiovascular and Respiratory Sciences and Study Design have a more academic scientific approach, whereas Reflections and Evaluation of Clinical Practice and Quality in Cardiovascular and Respiratory Healthcare are more clinically focused. So this slide summarises key information about these modules, including the number of teaching days and the assessment types, and I'll just take you through these core modules one by one. So Foundations is a double credit module. It's led by Dr. Rashida Chowdhury, who is an electrophysiologist here at NHLI. The module covers the physiology, anatomy and pathophysiology of the cardiovascular and the respiratory system. There are 19 days of on-campus teaching, and it's assessed with a written assessment and an oral assessment. Study Design is led by Dr. Andre Amaral. Andre is an epidemiologist here at NHLI, and this module teaches you the principles and practice of quantitative and qualitative research. There are 8 days of on-campus teaching for this module, and the assessment is a written piece of work. Moving on to our more clinically focused core modules, Reflections and Evaluation of Clinical Practice is led by Professor Elizabeth Renzoni, who is a respiratory consultant practicing at the Royal Brompton Hospital. In this module, our students are taught to critique clinical practice in relation to evidence-based guidelines and to reflect on how to improve clinical practice. There are 3 days of teaching here, but importantly, our students attend 4 clinics from our partner hospitals to observe the delivery of cardiovascular and respiratory healthcare, and the assessment for that is a written piece of work. And lastly, we have our last core module is Quality in Cardiovascular and Respiratory Healthcare, led by Dr. Peter George, who is also a respiratory consultant practicing at the Royal Brompton. And in this module, our students critically consider the factors which contribute to the delivery of high quality healthcare. There are 5 days of teaching for that module, and our assessment is an oral assessment. Moving on now to the elective modules. As I explained, we have 5 modules from which our students choose 3. 2 of the 5 modules relate to cardiovascular healthcare, and that's Innovations in the Management of Cardiovascular Disease, led by Professor Stuart Rosen, and Cardiovascular Health Prevention and Rehabilitation, led by Dr. Luxi Anathan. 2 modules relate specifically to respiratory healthcare. Those are pulmonary rehabilitation and community respiratory care, led by Professor Nick Hopkinson, and respiratory failure and respiratory support, led by Dr. Lydia Finney. Our final module is focused specifically on cystic fibrosis and is led by Dr. Sue Madge. So having introduced you to these taught modules, in the next couple of slides, I'm going to show you how these modules fit together to form your academic year. So this slide summarises the MSc journey for a full-time student. The timeline here shows when the different modules are taught during our academic year. We start in October with our core modules Foundation and Study Design. We then have 2 weeks off the winter break, and when we return in January, our students undertake their elective modules, and the exact timetables for these differ. They also begin teaching for the core module Reflective Practice and start their clinic visits for that module. In spring, we have another 2-week break before we return for the summer term. And at the beginning of the summer term, our students embark on their last core module, which is quality, and they also begin their research projects. During this time, some students may also be finishing up clinic visits for the reflective practice module. For those of you who are interested in studying part-time, here the programme is split across 2 years. In the first year, you will complete the foundations module in the first term. In the second term, you take 2 elective modules, and then in the final term, you do the quality module. When you return for year 2, you begin your second year with study design. You take your third and final elective module and the core module reflective practice. And then in the summer term, our part-time students begin their research project. So looking ahead, and should you wish to come and join us here at the National Heart and Lung Institute, these are some key dates for you. It's expected that Imperial will host its induction week for postgraduate students in the week beginning Monday the 30th of September. Teaching for the MSc will then start on Monday the 7th of October for the foundations modules. Our final assessment in the MSc will be in September 2025, with degrees awarded in November 2025. And finally, the graduation ceremony for that cohort will take place in May 2026. And we celebrate our students graduating in the truly remarkable setting of the Royal Albert Hall, which is just behind Imperial's main campus in South Kensington and overlooks Hyde Park. So an important question that we're frequently asked about the programme is, how will I learn and how will I be assessed? Our teaching and learning approach is very student-centred with multi-mode delivery. And what this means in practice is that we put our students at the heart of what we do in the classroom. And we've been able to keep the best practices learnt from recent years to deliver teaching in a wide range of formats. We teach using traditional lectures and seminars, but we also use hands-on workshops, problem-based learning, journal clubs, clinical case studies, guided online learning and video tutorials. We also use a wide range of experiential learning, and that's a real highlight of the programme for our students. I'll expand on that specifically in my next slide. The teaching is delivered by our clinical and research specialists in the field, and the programme is supported by myself as a dedicated senior teaching fellow. Finally, we assess your learning using a range of authentic formats to showcase your knowledge and the skills that you've learned. And these assessments include scientific report writing, oral presentations, poster presentations, case study analyses, and journal clubs. We describe these as authentic assessments, as they are deliberately designed to replicate professional activities undertaken in the workplace. And this means that our assessment strategy allows you to develop and showcase the skills that you will actually go on to use in your working life. So as I said, our experiential learning opportunities are a unique part of our MSc, which really sets us apart from other programmes that are available. And experiential learning means learning through experience. Here at Imperial, we make the most of the remarkable facilities that we have available in the Faculty of Medicine and at our associated hospitals to create learning experiences for our students which cannot be accessed anywhere else. And our students frequently cite these experiences as highlights of the MSc for them. So we spend 2 days at the Human Anatomy Unit at Charing Cross Hospital. Here we visit the Pathology Museum and also the Human Dissection Rooms, and this allows our students to experience and learn cardiovascular and respiratory anatomy hands-on. Our students visit the cardiac catheterization labs at Hammersmith Hospital, and they complete exercise physiology projects up at South Kensington for their foundations assessment. And lastly, we're especially pleased to be able to take our students to a scientific conference. In November, as part of the Foundations module, our students visit the winter meeting of the British Thoracic Society. The British Thoracic Society is the UK's premier society of leading respiratory healthcare professionals and scientists, and it's an opportunity for our students to hear the latest research firsthand and, of course, to network. Moving on now from the taught elements of the programme to your research project. The research project is really the capstone of the MSc. It's where you can apply and develop all of the skills and knowledge you've gained during the taught modules. Our research projects are supervised by our academics here at the National Heart and Lung Institute, and during your project you will become embedded within their research team and take part and contribute to the cutting-edge research that we carry out here at the National Heart and Lung Institute. You'll be stepping up to work alongside the academics and researchers whose work you've been learning about during the taught modules. We offer a range of different project types from both the cardiovascular and respiratory fields. The projects include clinical research, where you'll be collecting data from patients and healthy volunteers who visit our clinics. Laboratory projects where you can carry out experiments in our world-class facilities. Some students choose to do data analysis projects or systematic reviews of the literature, and these projects can offer some flexibility, especially for those who may be studying part-time. And for students who are interested in improving healthcare, we offer service evaluation and quality improvement projects. And finally, our students have the opportunity to develop their own projects alongside an Imperial academic. Now I'm going to move on to talk about what happens next to our graduates. An MSc is a stepping stone for you, and it should open up many different and many exciting opportunities for you. We now have from our programme over 100 graduates. And being a healthcare MSc, it'll be no surprise to hear that many of our graduates go on to pursue clinical careers and careers in healthcare. Each year, a large number of our graduates go on to study medicine, either undergraduate level or graduate level. Some of our graduates have joined the NHS Scientist in Training programme, which is extremely competitive, and they're now working as cardiac physiologists in the NHS. Our nursing students have used their qualifications to gain promotion and are now practicing as clinical nurse specialists. Some have moved to become research nurses, and others have transitioned out of the NHS into the charity sector. A large number of our students go on for further study at PhD level, and we currently have 5 students undertaking their PhDs at Imperial based on their MSc projects, and one of our current students is working with their project supervisor now to develop their project into a PhD project. In addition, our graduates have embarked on educational careers as university lecturers, both here in the UK and overseas. And lastly, our graduates also move into industry, working as project managers, medical writers, and so on. So I'm finally on to my last few slides, and I hope that what Dowell Dawn and I have shown you today has tempted you into applying to study our MSc here at Imperial. So what follows now is some key information and the next steps that you can take. The entry requirements for our programme are an upper second class BSc or equivalent in a medical, biomedical or healthcare subject. If you speak English as an additional language, you'll need to demonstrate your competency in English by meeting the college's higher English language requirements. Applicants must also submit a personal statement demonstrating that the course is right for you and that you have the knowledge, skills and aptitude to achieve the course requirements. And lastly, your application must be supported by 2 references. Applicants who meet the first 3 requirements are guaranteed an interview with us once your reference has been received. If you do not meet the programme's academic requirements, or if you are currently an undergraduate student and do not know your results yet, Please do apply anyway, as your application will be assessed on its merits, and in such cases your personal statement can be pivotal. It may be that you don't meet the university's minimum requirements, which is a second-class degree or a 2-2. In this event, then there is a special case procedure for applicants who have sufficient professional clinical experience. And lastly, we do not accept intercalating MBBS students on the MSc. In terms of the actual process for applying, applications for entry for the academic year 24 to 25 are now open. Applications must be made online, and you have to apply via My Imperial, which will require you to register. You can submit one application form per year of entry, and you can choose up to 2 courses at Imperial. There is an application fee, but we do have fee waivers for those who meet the criteria, so please do contact us on the MSc email for information about this. We review applications weekly, and we hold interviews twice a month. Outcomes are then communicated to our applicants within 5 working days, and if you're successful, the university will make you an offer which will outline any conditions that you're required to meet. The deadline for home applications is the 1st of August this year, and the deadline for overseas applications is the 30th of June. We close our overseas applications earlier to allow time for our offer holders to complete the visa paperwork. We do strongly suggest that you apply early, as we will close applications once we fill up. This year, we're delighted to be able to offer one scholarship specifically for the MSc. This scholarship will award £3,000 towards your tuition fees. It's available to home and overseas students who will be starting in 2024. And to be eligible for the scholarship, you must hold an offer for the full MSc. The deadline for applications is the 31st of May, and you'll find further details of this scholarship on our programme web pages. In addition, there are a number of other internal Imperial College scholarships. You can search for these on the Imperial website for suitable opportunities. The search tool looks like this, and you will need to filter the scholarships by selecting postgraduate taught courses and the National Heart and Lung Institute. Please do check the application deadlines for these scholarships. Some of them have already passed for this year, and also the eligibility criteria. And this is my final slide. If you have not joined our mailing list, please do so now. The link is on the screen and we'll drop it into the chat. This allows us to keep you updated with the latest news and key dates. So thank you very much for listening to Dowell and I as we tell you about the National Heart and Lung Institute and our programme, and we're happy to answer your questions now.
I have put into the chat that if you want to put your questions into the chat, you can do so if you don't want to speak. Otherwise, you can raise your hand and ask your question by asking.
I can see someone is typing.
Ah, good.
Typing a very long question.
Okay, so the question is there any quota cap for home versus internal applicants? No.
Best candidates.
Oh, India.
I understand. No, it's best candidates will win. So apply without fear of persecution because of where you're applying from.
Dawn, you're on mute.
Tevodros is now
Okay. So
I was just detailed question coming. Okay, yeah. I'm just excited. I'm trying to guess what it's going to be from the pattern of the pulsing dots.
I was just saying, if you think of a question later, you can email me on the course email address, and I'll do my very best to answer you. If I don't know the answer, I usually know someone who does.
Everyone is staring at the dots with anticipation.
It's exciting.
Oh no! I thought we'd lost inspiration there for a moment.
I think we've gotten very good at anticipating the information that people need at these open events as well. So we run a number of these. We run a number of these open events over the year, and we've done them for for the last 6 years now. So generally, I think we have all bases covered. And of course, the colleges in Imperial's websites are very comprehensive information that the students might need as well.
Is it okay to upload myself? Yeah.
Your question is about a reference letter. I'm presuming this is to go along with an application. So your reference needs to be uploaded onto the online system. If you have any problem with doing that, you need to email the admissions team, or you can email me.
Well, Dawn, I think what he's asking is that is it okay if he does the uploading, or does it have to be the teacher that does the uploading? Because it's boring for the teachers to upload lots of reference letters. I sympathise with them. Actually,
I understand. So if you have the reference, then you can send it to me. But the problem is they will only accept the reference from a verified email address. It has to come from the email address of the person that's written the letter, and it has to be an official email address. It can't be Gmail or anything like that.
But how about the upload process, though? For example, so Tevodros, what I suggest, so is it that they send an upload link to that email address, and then the teacher uploads it from there? Is that how it works?
Yeah.
Because then there might be a way that he can give the teacher's email address, and then when the email address is sent a link, the teacher could send that to Tevodros and he could upload it. Maybe.
I don't think they will accept it. No.
But they won't know, because they'll send the link, which will have all the credentials, and then he can upload it.
No, I think it has to come from the referee's official email. I think it's just a security thing.
Of course,
I mean, if there's a huge problem, then email me and we'll find a way around it.
Yeah.
Okay.
We will. This has happened before, so we can find a way around it. But initially, I think the referee does need to do it.
Okay. And then, so someone is asking about the GPA requirement, because their university in Hong Kong uses a 4.3 GPA scale. What does a 4.3 GPA scale mean? Does that mean you can't get more than 4.3? It's a bit harsh.
We have a. I'm just trying to copy the link for this. So I'm right.
Oh, that an A plus is a 4.3. Oh, I see.
So generally, a 4.3 would be. No, hang on. Right. So generally, between a 3.3 and a 3.9 GPA would be acceptable as a 2-1. However, there can be variations between different institutions. So this may be something that you want to clarify with admissions. And there's a link in the chat now for the accepted qualifications. Yeah. But as Darryl has put in the chat, a 3.3 to 3.9 would usually be acceptable.
Okay.
Yeah.
Excellent.
Again, if you have any problem with it or you want to find out more, just email me. I'll try and find out for you.
Great. Those are good questions. And that is great. So if there's no more questions, I'm delighted to call the proceedings to a close. And we will look forward to your applications. As I think almost everyone on the call has asked a question. So that's excellent. All right. Yep. Thank you very much. Very good interactions.
Yeah, and don't forget to email me if you think of anything, as I usually do, think of it later.
Yeah.
So just drop me a line.
Okay, wonderful. Thank you. Bye-bye, everyone.
Thank you.
Bye.